Yes, Major General Sadaqaji, do stay with us for further stories, but thank you very much for bringing us your insight on that unfurling situation in the Middle East. We now move over to the United Kingdom for our next story. And resident doctors in England have begun a 5-day strike, marking the 13th walkout by members of the British Medical Association in their ongoing pay dispute. The strike, which affects both emergency and non-urgent care, will run until next Wednesday morning. With resident doctors comprising about half of the NHS workforce, hospitals are expected to face significant pressure during the action. However, NHS England has said that 95% of non-urgent procedures like hip and knee operations will continue, with consultants and senior doctors covering for the striking workers. Despite disruptions, NHS leaders estimate that the strike will cost around £240 million to manage. The situation comes as resident doctors in Scotland are also considering going on strike over similar pay concerns. Keith Vaz joins us. He's a former UK minister and he joins us live from London. Keith, always a pleasure. This is the 13th strike by resident doctors in the UK for NHS England. Do you think that the government has mismanaged this dispute to the point where strikes have almost become routine?
Well, it's very disappointing. Good morning from London, by the way. It's very disappointing that the doctors are on strike against a Labour government, because one of the cardinal principles upon which Keir Starmer and the Labour Party ran its election campaign is the importance of the NHS. And other sectors, for example, transport sectors, train drivers and others, have had big increases. So the doctors are saying, well, what about us? We need this rise because we've been suppressed as far as our wages is concerned for many, many years under previous governments. And here we have a Labour government that needs to really make sure that we are getting the rate for the job. Now, although the NHS management is now saying that they will manage the strike and people won't lose out in terms of operations, I mean, I myself was waiting for an operation from the NHS, and I had to do the best I could waiting for that. I know other people who are actually waiting for a year for a hip replacement operation. So from that point of view, I'm worried that people are going to have to be in pain and waiting for much longer. This is a strike that's going to be settled. You and I both know you don't take on the firefighters, you certainly don't take on the nurses, and you don't take on the doctors, because they are the very basis of the National Health Service. And I think that they've fallen behind as far as their pay is concerned. Wes Streeting, who's the Health Secretary, as you know, has been involved in this potential coup against Keir Starmer that was not happening, and he knows nothing about it. I think he's a very good Health Secretary, and I think he is of the same mind as people in the health service. So I would be surprised if he did not use his considerable communication skills in order to try and settle this matter. At the end of the day, talking is one thing, cash on the table is another, and you really do not want to take on the doctors.
Yeah, and Keith, just briefly, of course, you mentioned there that this is happening underneath a Labour government, of course, a relatively new government, but this is, once again, this is the 13th time this has happened, and resident doctors make up half of the National Health Service workforce. How much political responsibility should the government bear for letting these relations deteriorate to this level?
I think that of course, they have to have responsibility. They're the government. I mean, one of the things they do is manage the NHS. And Wes Streeting decided that he was going to abolish the quango that was running the NHS England, and replace it with himself. So he's running the NHS now, and therefore he will take responsibility. He's not the guy, I've known him for many years, he's not the kind of guy who is not going to take responsibility. But you do have to come to a conclusion that this needs to be settled. They have to settle this. One, for the goodwill of the doctors themselves, but secondly, and more importantly, for the patients. I've just come back from India, and I visited a couple of hospitals. By the way, today is World Diabetes Day, so can I urge all your listeners and viewers, including you, to go and take a diabetes test, because that's one way of preventing going to hospital in the first place, by knowing you've got diabetes. But when I went to India recently, I found a large number of people who actually were coming to India and having their operations because they felt it was quicker, more efficient, and cheaper than having it in the UK. So we're on a slippery slope here. We need to really settle this dispute. And I think the doctors are going to be saying, we need it. Otherwise, if you don't give it to us, we're going to go to Australia, we're going to go to the United States. We have got the skills necessary to go anywhere in the world, including in India. So they need to get on with this and settle this strike. We don't want a 14 strike, for sure.
Yeah, indeed, Keith. Thank you very much for joining us. Some great insight there. Thank you very much for taking the time and talking to us, as always. We now